Let's study something until you become a neonatologist. We're going to stick in the derm world again, and we are going to look very quickly at this rash. So this is around the umbilicus, that's the umbilicus there, and you have a rash that's on an erythematous base, so a red base, so there should be some red flags going off there. And they are like these white looking, I would call them vesicles. So right away I'm concerned about HSV. So HSV is perinatally acquired, so the baby got infected just before birth or through the birthing process. There are two types of HSV. There is the mucocutaneous variety, so SEM, skin, eye, and mouth, and then there's disseminated or CNS, which is HSV encephalitis. SEM is typically very responsive to antivirals and has very good outcomes. Typically, if someone is infected with HSV 1 or 2 for the first time, it isn't painful lesions, it's just these vague cold-like symptoms. So you want to ask the parents about those types of symptoms, if they experienced them before delivery or during delivery. And then if the baby is appearing like they're not feeling well, so not eating well, maybe has a low-grade temp, or just looks a little more lethargic, you'll do a sepsis evaluation. If HSV is high on your differential, which it should always be in the back of your mind, you can get skin swabs, so umbilicus, nares, mouth, various areas of the skin, and then you can also get a PCR to send to the lab with your bacterial blood culture. About 20% of the mucocutaneous infections don't have a primary lesion, so it does help when you see the lesion, but again, you don't always see it. If a baby is presenting with HSV encephalitis, they are oftentimes very sick, seizures, lethargy, non-responsive, etc. One thing that can differentiate bacterial sepsis from HSV is looking at the LFTs. They are typically elevated earlier in HSV than with bacterial sepsis. Treatment for both SEM and disseminated is antivirals, and the difference being just the length of treatment. So if there is CNS involvement, it's typically much longer than if it's just the mucocutaneous involvement.